Hi, my name's Ashton, and I'm doing a teaching strategy with role play. In today's situation, we're going to have somebody who's coming in for an injury to the ER, to her arm. She'll explain to us what's going on. I'm going to be role playing as a nurse because I'm showing a communication tool called AIDET for nurses to use when introducing themselves to patients and coming into a patient's room. This could really be used by any healthcare provider when speaking with a patient. It could also be used in other situations outside of healthcare. Could be used for something like meetings in an office. It's just about addressing the person, making sure that you're explaining everything that's going on, and getting their feedback. I also have two other students today who are going to be watching this presentation. This is Aaron and Trent. And then you'll notice the props that I'm using today. I'm using a blackboard, so it's gotten written on here. Name of the nurse, we have our physician's name, we have our date, and then we have our patient's preferred name. These are all questions that we will answer when coming into a room. Other props that I'll be using are a bag of ice for injury, and then we have a pillow prop set up for our patient. Okay, so now we're going to set up with our scenario. She's coming in for an injury. I'm going to come in and introduce myself.
Come in.
Hi, Miss Escobar. My name's Ashton, and I'm going to be your nurse today. Do you have a preferred name for us to call you while you're here for your visit?
Grace.
Grace? Okay, I'm going to write your name up on the board, Grace. That way everybody who comes in will know what to call you. And again, my name's Ashton, so I'm going to write it up here. So you want to tell me what you're coming in for today? I wrote over some of the triage notes, but I want to hear in your own perspective what happened.
So I'm trying to pick up gardening as a hobby, and I don't know anything about gardening. I'm not even in my backyard ever. And so I try to clean up some weeds, and so I lifted this rock, and out of nowhere comes this big gecko, which I have this huge phobia of geckos. Like, I just can't be around them. So I try to run away. I'm like screaming my head off. And then while I'm trying to run away, I fall on my arm, and now I think it might be my wrist or, I don't know, this area, and it hurts so bad, so I can't move it or anything like that.
Okay, so that's what you're here to see us for today.
Yeah,
We're going to be checking out your wrist.
Yeah.
Well, perfect. So I went ahead and took a look at some of the orders that Dr. Navarro placed. I'm going to write his name up here on the board so you know who we're working with today. Navarro. And it looks like he's ordered an x-ray of your wrist, and he's also ordered some pain medication for you as well. Are you taking any current medications that we should be aware of?
Yeah, I take Keppra.
Keppra? Okay. And are you allergic to any medications?
No, but if we're going to do an MRI or any of that stuff, I'm allergic to the contrast dyes.
Allergic to contrast. Okay, well, if we do anything like that, I'll be sure to let the physician know.
Thank you.
I'm also going to write today's date up here. You're coming in today. It's June 28th. That way you know your stay is with us right now. On a pain scale right now, 0 is none and 10 is the worst. Could you rate your wrist pain for me before I give you medication for it?
Like an 8. I fell on it really hard.
Okay. Alright, so first of all, I'm going to give you some ice that we're going to place on your wrist. And I am going to come back again with a pain medication called tramadol. Now, tramadol is going to be a medication you're going to take orally. It takes roughly 30 minutes to start kicking in to start relieving your pain, okay? So it will take a little bit. Also, we're going to keep your arm elevated, okay? Rest it, elevate it, put some ice on it to keep some of the swelling down. Now, as far as x-ray goes, we're going to have to get a urine sample before we do the x-ray, okay? We just have to make sure that you're not pregnant, just as a regard to x-ray.
Even for a hurt arm?
Even for a hurt arm, any type of exposure, we've got to make sure that you're not pregnant. We don't want any radiation harm. Also, a radiation technologist will come in here and they're going to take you to x-ray. Usually takes about 10 minutes or so. They'll wheelchair you there and back. Now, after they do the x-ray, it depends on how long it takes for the radiologist to read it. So it may be anywhere from 15 to 30 minutes for us to get the result of that x-ray. You have any questions about that?
When can I go home? Like, how long is this going to take? I mean, I've waited in the ER forever already. How long? I mean, I want to go home.
That's perfectly understandable. So the order was placed about 5 minutes ago. I'm in here to inform you. I'm going to call the x-ray technologist after I leave the room to let them know that you're ready to go. I'm going to escort you to the bathroom first as soon as we're done here, and we'll get a urine sample. So maybe within 15 minutes of that, they should be in here to take you to x-ray. And again, x-ray is going to take roughly 5 to 10 minutes, and you'll come back to your room. and I'm going to give you a medication before you go as well to x-ray, okay? So after we do your urine, you'll come back and I'll give you the medication so that maybe start kicking in to handle some of your pain.
Thank you.
Hopefully it only takes roughly an hour while you're here. Once we have the results back again, our physician will come back in and address the results of the x-ray with you so that you know what's going on. Okay?
Thank you.
You're welcome. Okay, so in this demonstration you saw that we did role play. I want students to switch positions and I want them to practice being the patient and also practice being the nurse. They need to know what it's like to come in. What kind of questions would you want answered? How do you want to be addressed? Do you want to be thanked for your visit? Using AIDET, this is acknowledging. So when I first came in the room, I acknowledged my patient. I called her by name and I asked her, did she have a preferred name to be called? Second, I introduced myself. My name is Ashton. I also introduced our other healthcare team members and wrote their names on the board so she knew who she was working with today, who already came in to see her. Also, we went with duration. We told her how long it was going to take roughly for her to get an x-ray, how long she roughly might be here, and how long it might take for x-ray results to come back. We also did an explanation of why we were doing the x-ray and why we were giving pain medication. We want to control her pain. We also need to make sure there isn't any further harm going on with her wrist. If something else was further wrong, we might have to go into splint, so we might have to do wrapping. That would be further education that you would come in and address with this patient. At the end of their visits, we always want students and nurses to thank that patient for coming to our facility. Thank you for choosing us and choosing to come see us today. We want to make them feel like they're expected and that they're wanted. All right, if you have any questions, make sure to email me or leave a comment. Thank you.